ago, the ESGE has established a non-surgery gynecological disease working group. So what's the purpose and mission? What's been done since its establishment?
Well, I am right now the managing director of the European Society for Gynecological Endoscopy, and it was one of my tasks to inaugurate this working group. And it's a working group on the non-surgical ablative therapy of benign disease of the uterine wall. And what is the purpose of this working group? The purpose is that most of the HIFU therapies that have been done in the world, and most of the studies that have been done, are studies out of Asia. And what we want to know in Europe, and this will also account for the American region, what we want to know is if all the good results that we see in the studies, are they comparable or transferable to Europe? So one of our goals is to find out if the effectiveness of the HIFU in the diseases of the uterine wall is comparable Europe to China, Europe to Asia.
What do you think of the future of the minimally invasive and non-invasive medicine, and what role will have played in it?
Well, the role, if you followed my lecture a few minutes ago concerning adenomyosis, I think in many diseases there is no other possibility than to use HIFU. For example, adenomyosis, if you have a sclerotic or a diffuse adenomyosis, and the lady wants to keep her womb, wants to keep her uterus, or wants to become pregnant afterwards, there are not so many other possibilities. Because, for example, if you are giving medical therapy, this therapy only works as long as you give the drugs, as long as you give the pharmacy. If you stop the pharmacy, the therapy stops. And the open surgery is destroying too much of your uterus. So you will have problems afterwards to get pregnant. The problem also there for adenomyosis is that there is not really an alternative. Open surgery is no alternative, robotic surgery not, laparoscopic surgery not, and medical therapy also not. But it's not only adenomyosis, there are also other diseases like inoperable pancreatic disease. If you have pancreatic cancer, there is no other possibility than to use HIFU because there is no other therapy that seems to be effective.
So what are new technologies or the perspective you will bring to us?
Well, I think it's the other way around. I want to take something from you.
Yeah, well,
Yes, because in Europe we have a very high standard of endoscopic surgery. We have a very high standard of minimal access surgery. For example, in my department, benign diseases, only 3% we do open surgery. All other surgery is laparoscopic or hysteroscopic surgery. So we have a very high standard. But there are other parts in this world where this standard is not very high. Look at America, only 40% of the surgeries are done minimal invasive. Look at many parts of Southeast Asia, there is not so much of minimal access surgery. So one of my tasks as a member of the Directory Board of the European Society is to implement training and education in minimal invasive surgery in Southeast Asia and also in China. We have a pilot project called GESEA in China where we are implementing our training and education of the European Society into the Chinese Obstetrics and Gynecological Society.
Thank you. So next one is, so in your perspective, and so what aspects do you think China or Chongqing should focus on to strengthen the cooperation with the academic exchange and to go globally?
Well, I think going global is important. We have to think further than Europe. We have to think further than China. We have to look at the whole of the world. And there, like always in life, it is not only one thing that is productive or effective. There are many different solutions. So if there is somebody and she says, I have this big menstrual pain and bleeding disorder, but I don't want to get pregnant anymore and I want a permanent solution, take out my uterus, I think it's okay. We should do it minimal invasive, but we should do it with a surgery. But there are many diseases where you cannot do good surgery, and there are many ladies who don't want to have any surgery. So in those cases, we have to think about alternative solutions. And we should not think about China, we shouldn't think about Europe, we should think about the whole of the world. How can we take care? And there are some differences. For example, Black Americans or Africans have a very high rate of myoma, a very high rate of problems with their myoma. Other countries, they have a lower rate. So it will also depend on the different regions. But as a global construct, you have to be open for all kinds of therapies to give the optimal therapy to the lady, because this is what we want. We don't want to take care of disease. We don't want to take care of a country. We don't want to take care of technology. We want to find the best solution for the lady that we are taking care of.
Yeah, just because HIFU is one of the very famous, the intellectual property rights, right? So how could China and Chongqing to promote the new technology, that protect the new technology? Like, do you have any suggestion, or do you have any expectations about that?
Well, I'm not a significant guy in case of protection. I only know that it's important to have a good technology and to implement it in the different countries. This is for me important. And if I have an ultrasound machine, I also don't think about protection. I just think about I have an ultrasound machine that is doing a good task in diagnostic ultrasound. So for me, protection is not what is important. For me, it's important that we have a good cooperation with China, so China can give us the machines that we need. And unfortunately, the last 3 years, we had nothing, because we are right now at the same situation we were 2019, because we had 3 years of slowdown due to the pandemic. So I think the future will be an enhanced cooperation with China, and China bringing us the machines that we need to continue with our main goal, taking care of our patients.